Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis.
I'm Ron.
Jean Marie is not with us today, and I'm Lita. Collectively, we're the hosts of PodcastDX. On today's show, we are speaking with Ella Eastin, Ella as in Cinderella. If you follow the world of competitive swimming, then you probably know a bit about today's guest, one of the world's fastest swimmers. Ella Eastin is a first-year medical student at Stanford University School of Medicine. She completed her undergraduate education at Stanford and was a member and captain of the Varsity Swim team, where she earned 12 national championship titles and set 4 American records. Hooah!
Wow.
Ho-ho!
Fantastic.
Following her graduation in 2019 with the BS in Human Biology, she competed professionally as a member of Team USA. However, her Olympic aspirations were cut short due to a COVID infection, which led her to developing Myalgic Encephalomyelitis, chronic fatigue syndrome, and Dysautonomia, resulting in her retirement from competitive swimming. I guess I hooahed too quickly. I'm so sorry. To raise awareness for individuals affected by chronic illness and disability, she founded Dysunderstood. Oh, I love that. A community platform for patients to share their experiences. As a future healthcare provider, her goal is to bring attention to these debilitating conditions and provide unwavering care for patients facing lifelong health challenges. Thank you so much for taking the time to speak with us today, Ella.
Well, thank you so much for having me. It's great to meet you and be able to chat.
It's our pleasure.
Absolutely. You've a lot of accomplishments. That's fantastic.
Thank you.
I guess jumping right into us, Ella, could you tell us what events led up to your diagnosis or diagnoses?
Of course. Well, this can be definitely a long and windy story, as you can probably imagine. But I was training competitively in swimming, like you mentioned, in 2019, and was really looking forward to 2020, where I was hopefully going to have the opportunity to compete for a spot on the Olympic team. And every year my team actually went to Colorado Springs, where we did an altitude training camp right after Christmas, and kind of kicked off the year really strong with some really hard training. And a group of my teammates got this really mysterious flu-like illness that wasn't the flu in December of 2019, early 2020. And I somehow was not affected at the time. At least I was asymptomatic, we think, and came home from that trip really excited about my training, and took a nap after a morning practice one day, just, part of my everyday routine. And I woke up from my nap and got out of bed and, started seeing stars, got really dizzy, and then found myself on the floor of my bedroom, not really knowing what happened. And so that was kind of the first event that I explicitly remember, something being off. And I told myself, a million different reasons why that could have happened. I was exhausted. I was dehydrated. I had just come back from altitude. And, when you're training that hard, you're always tired. You always are having some sort of, ache and pain that you're managing. And so I, for a long time, used a bunch of different explanations as to why I could be feeling this way. But even just after a few days of not feeling myself, I got back in the water the next morning after taking the rest of the day off, and felt like I was moving in slow motion. I couldn't get my heart rate up. I felt really fatigued, which, the exhaustion was easy to explain away by training and different things going on in my life. But it it took me 10 months to get diagnosed, and there were a lot of events that unfolded in between that first episode of, the fainting like episode, until I was diagnosed. And that's a really, really long journey. But I always emphasize that I was in a very good position in terms of like my status as an athlete and being connected to Stanford, with, the healthcare here, and, family who was willing to support me in seeing any physician that I could to get this diagnosis. And it still took about a year. Um, and my health at that point was my greatest asset as an athlete. And
Mm-hmm.
so that was the priority. And it still took a very long time, which is really disheartening because there are so many people that have so many other barriers to accessing this type of care. And the average time to diagnosis is, 5 years, for people like me. And that's just way too long for individuals to be suffering with all of these conditions. So
We agree. We agree completely. And I imagine an athlete of your caliber is pretty in tune with their body. So when you noticed that something was off, what steps did you take to actually get this discovery in gear?
yeah. Yeah. So it was after a couple of days of not feeling myself, where I could no longer patiently wait and try to sleep it off. um, I, saw a couple of physicians at the time, and in different specialties. I needed to see someone in endocrinology, and it wasn't super surprising that some of my hormones were off, because I was training so hard.
Mm-hmm.
And it's very, very common for women to have, challenges with their menstrual cycle whenever they're training super hard, or if they're managing an illness. And so um, unfortunately that wasn't surprising, but then that was an easy thing for physicians to say, like, oh, it's probably this. And so I went from, one lab value to the next to try to figure out if it was the vitamin D or if it was the estrogen, or there were so many different things that were not perfect, that we had to experiment to try to get back to normal. And so but I think that by the time um, March rolled around, so maybe 2 months after starting to really, really not feel myself, was when I was fully convinced that it was not just an overtraining or hormone or nutritional imbalance issue. Um, I had a gut feeling that something was different, and was able to, look back and put some pieces together and say, this is really strange that all of my teammates, came down with this flu-like illness that wasn't the flu. And now we're, in the midst of this growing and worsening pandemic of, people getting these illnesses that are very much flu-like, but they're not the flu. And at the time we didn't have tests. And so nobody knew really about COVID. And now they look back and say, yeah, it was probably here months and months before we even recognized. And so, that was definitely helpful in looking for some answers, because now we could think, oh, maybe this is something post-viral. And, I was at home. The pandemic was honestly necessary for me in that time of need, because I had to be completely taken care of by my mom. I was, at one point for probably 6 months completely disabled, to the point where I couldn't make food for myself, I couldn't do my laundry. And I got incredibly lucky that I could go back home, and because of the pandemic my mom was working from home, and so she was able to take care of me, which was a huge burden on her. And I'm eternally grateful for everything she was able to do for me, including support me in my appointments and make sure that day to day I got what I needed. In addition to, all this time trying to continue to be a professional athlete, which I look back and, wish I wasn't so hard on myself to try to get better so quickly. But at the time, my my physical health again was my biggest asset, and so that was the priority at first. But I think that it was very clear to me that once I saw a physician and they thought that it was going to be a quick fix, that I knew I was going to have to look for someone else to kind of help me navigate this, because it was very mysterious and really, really challenging to identify. And I knew my body better than anybody. And as you said, I'm pretty in tune. And so any small difference was obvious to me.
Right.
And I was so lucky to ultimately, find a doctor who happened to be connected to the swimming community that was willing to see me as a pediatrician on the weekend because of the upcoming Olympic trials. And, he was willing to consult with me. And within a couple of minutes, I was able to get a diagnosis from him. And that's because he's been working with patients like me for decades. And he's a diamond in the rough. And he completely changed my life when I got my diagnosis, because I was able to try something, that may be effective and make small steps, but then also realize like, oh, this is a journey and I need to reflect on, what's the priority here. And within about a month and a half after my diagnosis, I realized, I need to stop fighting my body. I need to give myself ample time to rest. No one's doing anything. I'm not missing out on anything in the world because of the pandemic. And so I ultimately decided to take a step back from swimming, in December of 2020, a year after I had, my first symptoms, because I realized, the only way I'm going to be able to get back even to being able to swim is to first get healthy. And so when I finally let go was when I saw the most progress in my healing.
Okay. All right. Ella, it's widely accepted that chronic fatigue syndrome and dysautonomia, which is a dysregulation of the autonomic nervous system, is really common. And there are two different types of orthostatic intolerance: postural orthostatic tachycardia syndrome, POTS, and neurally mediated hypotension, NMH, have been found. Do you know which of these two types you have, and what symptoms do you have the most frequently? And boy, I'm asking too many questions in one. And how do you and your medical team handle them?
Yeah, so I actually was diagnosed with borderline POTS. So the criteria for postural orthostatic tachycardia syndrome is a 30 beat per minute change in heart rate when you go from the lying down, so supine position, to up, standing up. And the change in my heart rate was 29 beats per minute. And as an athlete, my heart rate was pretty low to begin with. But when my heart rate did change, 29 beats per minute going lying down to standing up, it was quite jolting. And I experienced the lightheadedness that comes from changing position too quickly, in addition to my blood pressure not being able to accommodate. And so because there is a lack of vasoconstriction in that change in position, your heart compensates by trying to beat faster to get that blood to your brain. So I do essentially have POTS. On the day that I was tested, it was only 29 beats per minute change, but I guarantee that, the test that I did at home that said that it was more. Exactly. So I definitely have the lightheadedness. there's a lot of fatigue that comes from the orthostatic intolerance. So not only was I managing the chronic fatigue, that was, exhausting in and of itself, but having that orthostatic intolerance where your body has to work really hard to be in the upright position, extra fatigue came from that. And so I was immediately told to increase my salt intake, which is definitely helpful in maintaining some higher blood volume, and also to be better about my electrolytes. I was drinking tons of water as an athlete, but I was drinking a lot of plain water, and I needed to make sure that I was getting salt and potassium. I also wear compression socks, which has been incredibly important for me now too as a medical student. I'm on my feet a lot, but also even just sitting a lot. That's still considered an upright position.
Right.
And so making sure that I have, compression garments on when I need them, using cooling, techniques to be able to, especially when it's hot, because I have pretty bad temperature regulation and heat intolerance. And so having some cold packs nearby is really helpful. And then also just focusing on being really, really strict with my general wellness. I needed about a year of not doing much physical activity, which was obviously very new for me and very challenging to navigate. I went from exercising, 4 or 5 hours a day to, maybe going to the grocery store with my mom as my physical activity for the day. And so that was a major change, but I needed the rest. And there are arguments back and forth about, what the best thing to do is to manage POTS. But because I was managing chronic fatigue at the same time, it was like, that was the priority. And I'm still managing that to a lesser degree, but I took the time to rest really, really aggressively for the first year, because once I had, determined that I was not going to compete any further, that was my sole priority. And so it was to get healthy. And so even though it was really challenging, I just rested and eventually was able to integrate certain activities into my schedule again to help my symptoms. And I've recognized that doing weightlifting has been one of the things that helps me, because it increases my blood pressure and isn't a long duration of change in heart rate. I have the hardest time swimming, unfortunately. That's one thing that I have not really been able to manage still. And it's been a couple of years. But doing lower leg exercises is really, really helpful in getting that blood flow going. And those are the things that I rely on, that are, not prescriptions. Those are, daily, wellness
Yes,
things.
that's great. That's great.
So I need to say the name of the illness one more time, because I think we're going to do a lot of abbreviating from now on, because it's so long.
Myalgic Encephalomyelitis, right?
Yep.
Okay.
Chronic fatigue syndrome. We'll just call it MECFS. Ella, how common actually is this illness? Do you know?
I do. So the important thing to note here is that there's an estimated 90% of people living with MECFS that are currently undiagnosed. The estimates are between 1 and 2 million individuals for people living with MECFS in the United States. So that requires meeting the diagnostic criteria, which are pretty specific. But there are way more people managing this illness than we give credit for, and that the medical system looks out for.
Right.
So it is not uncommon.
Okay. And what symptoms are associated with it?
Yeah. So the characteristic symptoms are um, essentially the diagnostic criteria, which include unrefreshing sleep. So this means, no matter how long you sleep, that sleep is not restful and restorative. Another one is post-exertional malaise, which means that an increase in activity level actually causes worsening symptoms and fatigue. So oftentimes individuals that are managing these illnesses are first diagnosed with psychiatric disorders and symptoms like depression and anxiety, which often are actually, these symptoms are often alleviated with exercise. But in individuals with ME/CFS, you find that the increase in physical activity or cognitive activity actually worsens their symptoms. And post-exertional malaise can last for a different amount of time for different people, but this includes, maybe an increase in brain fog, an increase in fatigue, or an increase in other symptoms that people experience. Another diagnostic criteria is that you have unexplained fatigue for over 6 months. And unexplained fatigue would mean you don't have a really good explanation for feeling the type of exhaustion that you're experiencing. And so even if someone's training really, really hard physically, after, a couple of days of getting good recovery and rest, they should be able to wake up feeling okay after, a couple good nights sleep. And they may have soreness, but those things go away. But if you are, minimizing your activity and you are still feeling fatigued, that is what that means. But oftentimes other, symptoms that are associated with it are brain fog, where you're having trouble thinking, cognitive dysfunction, which actually has been proven to be, I shouldn't say proven, but there is evidence that the reason that individuals with ME/CFS experience cognitive dysfunction is because they're actually receiving 30% less blood flow to their brain than a normal control. So the amount of blood that's actually getting to the brain is decreased by about 1/3, which totally explains why you would be having trouble finding words and thinking really deeply and having, memory challenges. And so that's been really great that they've been able to study the reasons for why these, symptoms are presenting. So those are just some of the major ones, but I think that they kind of highlight ME/CFS in its entirety.
Right. Thank you.
Mm-hmm. Ella, did you have any triggering event before you started experiencing symptoms?
Yeah, it's actually very common for individuals to develop ME/CFS after a viral infection, and in addition to potentially having COVID right before, like I think it was asymptomatic COVID that may have triggered my illness when I was with my teammates who were also sick. But there are, I believe it's almost 1/3 or 50% of people, at least in my age demographic, have mononucleosis before they develop ME/CFS. And I actually did about a year and a half before I had like really, really obvious symptoms. So I can imagine that definitely contributed as well.
Okay. All right.
Yeah.
And how did your healthcare team decide to diagnose you initially? Did you have a tilt table test?
Mm-hmm.
Okay.
Yes. So I actually, I did receive a tilt table test before I even met with the physician who ended up diagnosing me.
Oh.
And this was because I had a casual conversation actually with a family friend who their daughter has POTS and has been diagnosed, I think, maybe for 7 or 8 years now. And I was just explaining to her how I was doing, and she kind of casually diagnosed me on the spot and said, maybe you should consider maybe going to a cardiologist and getting this test. And so I went and got the tilt table test, and then was eventually referred to my physician, and I was able to bring those results to him. But because the most bothersome symptom for me was the fatigue, my physician was able to very quickly diagnose me with ME/CFS just based on the diagnostic criteria. With my explanation of, my symptoms and the answers to the survey about the unrelenting fatigue and the post-exertional malaise and all of those things that we discussed.
Okay. And
go ahead.
I'm sorry, go ahead, your turn. I was going to walk on you.
I'm used to it. Not from you, I'm just saying in general. I'm assuming, but I'm going to ask anyways, before you received your diagnosis, had you ever before even heard of ME/CFS? Or, I mean, you're young, so you were focusing on swimming and so on and so forth. Had you have heard of it prior to your diagnosis?
Actually, no. So I understood that there was something called chronic fatigue. My previous understanding was that was more of a symptom than an illness itself. And so the first time I had heard myalgic encephalomyelitis, chronic fatigue syndrome, was at the time of my diagnosis. When I was doing my own research before receiving a diagnosis, I was following some of a lot more of the literature on the autonomic dysfunction, which, under the umbrella of dysautonomia, for, different types of autonomic dysfunction, ME/CFS was there, but I hadn't looked into it much. And so it was kind of my first major introduction.
Okay. And how have you and your healthcare team chosen to treat or mitigate your symptoms?
Yeah. So there are some medications that can be helpful to treat symptoms. And that's something that, the idea that there's not a standardized pharmacological treatment or cure for these illnesses. Every patient is different in the symptoms they experience and the treatment that benefits them. And so it really is a lot of trial and error, depending on what symptom seems to be the most bothersome. We started there, trying, one treatment at a time to make sure that we were able to tease apart like what was helpful and what wasn't. I was able to receive a medication that helped me help my blood pressure increase, because that was a challenge of mine. And I also was able to, take out certain things in my diet that were, I think, maybe exacerbating some problems, but it was definitely a trial and error. And there are still days where I know that there isn't necessarily a treatment for what I'm experiencing. But the major symptoms that I was having are, have plateaued because of my consistency in adhering to the routine that we've created and the compression socks. And, my sleep is a non-negotiable now, which in the past I used to, give that sleep up, but now it's no longer an option. And my physicians are willing to, try different things now if something were to come up, but I am luckily at a point where I have plateaued with my symptoms and my current treatments are working for the time being.
Okay, good. And what role do exercise and nutrition play in your life now?
Yeah, that's a great question. Exercise and nutrition have been important to me, particularly as an athlete. And I know that I will never not be active in some capacity. And even when I was, bed and couch bound, I would do exercise horizontally, like Pilates. I would do something to get my muscles kind of moving without trying to trigger my symptoms. But I've been able to steadily increase the amount of activity that I do. including being able to run certain distances, which has been amazing for, to be able to clear my mind and have some amount of cardio back in my life. And like I mentioned before, weightlifting was one thing that I recognized was not too triggering. I can't, lift, I can't max out every single day with what I'm lifting, but I'm able to at least be able to activate and engage my muscles in a way that, keeps me feeling strong and, get the benefits of the exercise, like the endorphins and other things. And in terms of nutrition, cutting out gluten has been very, very beneficial for me. I wanted to, first get rid of some of the inflammation that I was experiencing at the beginning of my illness. And I do have some allergic tendencies in terms of like responses that I have to food that has gluten. And I used to have chronic sinus infections. And so I actually haven't had a single one since I cut gluten out of my diet. And
Oh,
so
wow.
that's
Oh,
something
good.
that gluten and dairy are kind of the two culprits for a lot of symptoms for people with ME/CFS and dysautonomia. And I am able to have dairy without any exacerbation in symptoms. So I feel lucky there. But gluten is something that I've been very strict about now for the past 3 years. And it's been incredibly helpful in, reducing, either sinus symptoms and fatigue. It's, if I were to have something with gluten the next day, I would almost feel hungover, which is such a weird sensation. But it definitely increases some brain fog and tiredness.
All right. Well, I think we could all learn from that.
Right, exactly. Now that we have discussed the basics, our listeners should have a better idea and understanding of this topic. This is actually an excellent time to remind everyone of our new endeavor. To better serve our guests and listening audience, we are now working as an affiliate with a major medical supply warehouse in the United States. You will find affiliate links on our website and learn more about this in future episodes.
Well, thank you, Ron. I guess I better get going. I got to get working on that. Ella, I understand that you are pursuing a graduate degree in nursing. How do you feel? Well, is it nursing or medicine? And how do you feel? Medicine. How do you feel your healthcare journey will affect your career?
Yeah. This is something I think about all the time, and I actually was going to pursue a degree in nursing. I have a family of nurses, and my sister is a nurse in the emergency department. My grandma was a nurse for, I want to say, close to 60 years.
Oh,
My mom has always been my mom has always been in fundraising, and she has worked in, the education system, raising money for nursing programs. And so nursing is very close to my heart. And I had the intention of going to nursing school when I got sick, and, was going to do that right after I retired from swimming. And once I actually got sick and met my physician who diagnosed me, I was immediately inspired by the way that he interacted with his patients, the research that he was doing to try to support his patients in real time. His practices were very different than some of the other physicians that I had interacted with as a patient. And I had, some preconceived notions of what practicing as a physician would look like. And he was able to kind of have like really open and honest discussions with me about what my daily life would look like, how I could support those in the dysautonomia and chronic fatigue community as a physician. And so I slowly became more open to the idea of pursuing a medical career, and ultimately decided that I wanted to go that route because, unfortunately, with the landscape of our healthcare system right now, the comma MD behind your name still carries a lot of weight. And so I'm excited about presenting the opportunities for nurses to practice at their full scope when I work with them. and really empower them to like do a lot of the same work. But because I had the opportunity to be a physician, I took that opportunity to try to maximize the benefit that I could provide to, you know, the chronic illness and disability community. But my journey is absolutely going to provide me the ability to empathize with patients that are going through this. I think personal experience, there's no replacement for personal experience when interacting with patients. And I think that, you know, although I am in a position where I am able to attend medical school and be pretty independent, I obviously have a different experience than some other patients, but I feel that I've been given this gift of recovery and have the responsibility now to pass that on to benefit the community that I still am a part of, and I very much identify with, and really really need people to be working to improve the landscape to provide better care and quality of life. So that is why I'm in medical school, and I continue to stay grounded in that, and it really helps me day to day remember, you know, why I'm working so hard.
Excellent.
Yeah, that's a great choice and good for you.
Yeah.
Ella, what do you feel is the most misunderstood aspect of ME/CFS?
Yeah, that's a great question. I think that every person is different in how they experience and navigate this illness. But I would say that, like I mentioned before, people have often been misdiagnosed with something that may seem like a more obvious explanation for their symptoms, including being diagnosed with psychiatric illnesses or other conditions that appear similar
Mm-hmm.
to some of the symptoms you experience with ME/CFS. But the majority of patients with these illnesses are young women, you know, with dysautonomia and chronic fatigue. I want to say it's like 70% young to middle-aged females that are affected by these illnesses. And I always like to bring up the fact that, you know, we are improving with our healthcare to, you know, improve equality for men's and women's health. But I think that we still have a long way to go with, you know, being willing to look at physiological reasons for certain symptoms instead of attributing them to psychiatric reasons. And I think that another thing that is important, you know, to me is that we don't know the etiology of these illnesses. We don't know why they develop. We don't know what causes specific symptoms. And so it's hard to have the answer for all of these things. And because of that, I think a lot of, you know, healthcare providers want to immediately provide help to their patients. But these things often take time and patience and perseverance to be able to treat effectively. And so I think it's hard to reach a diagnosis, but then also to find a provider that, you know, has the ability and the willingness to spend the time to navigate this long and often difficult journey with the patients.
Okay. Thank you very much. Do alternative therapies such as massage therapy, acupuncture, heat, ice, do any of those help alleviate your symptoms?
I have found that acupuncture is really, really helpful for me. I haven't actually done that in a long time, but at the very beginning, I think it was helpful in kind of balancing me in terms of my hormones and my energy. But I would always have to do it before I could rest because it always put me to sleep in a very, very peaceful and restorative type of rest, but definitely not something I could do before I needed to, you know, take an exam or something, because I always felt a little too meditative afterwards.
Okay.
But massage therapy, I do think is helpful, but also can sometimes be expensive. And so I think it's beneficial, but not something I do all the time. And then ice is definitely something in the heat that is helpful for me. The heat can be actually kind of detrimental. Taking hot showers is one of the hardest things actually for patients with POTS and dysautonomia, because the warm water actually causes your blood vessels to dilate, which means your blood pressure decreases. And so you're getting even less blood to the brain. And so that's often something that exacerbates symptoms.
Okay.
Yeah.
Good to know. Didn't think about it that way.
Mm-hmm.
And what are some of the less apparent parts of your life that have been affected by ME/CFS?
Yeah, I think that, a lot of things have changed as a result of my illness. One of them is, when you have reduced energy, you have reduced energy in a lot of areas of your life. And when you have, responsibilities in your work, or school or family, those things do come first. And at first it was, even now, it is challenging to put the time, physical and emotional energy into friendships and other relationships, when you are constrained by, a minimized energy level. And so I have found, I've been able to navigate my relationships by finding, like, okay, who are the people that are going to be the most understanding about my limits and my boundaries. And I have so many friends that have been so wonderful. And even before I got sick, we would spend months without talking to each other and then pick up the phone and we'd pick up right where we left off. But other times it's challenging to navigate, friendships that, require a little bit more time and energy. And so it can be really hard for anybody to navigate their social life when they are so limited with their energy. And I think that having a community of people that understand what you're going through is really important, which is kind of the reason that I started Dysunderstood, was to provide a space for people to share their experiences, but also meet other individuals like them, because sometimes you just need someone to understand what you're going through. And I think, once again, there's no replacement for personal experience. So
Yeah, very, very true. Ella, we're interested in hearing more about your Solve ME/CFS initiative. Can you tell our listening audience more about it?
yeah, so I am familiar with Solve ME/CFS because it is, I would say, probably the largest or the major ME/CFS organization. So I am not associated with the organization in any way other than being a fan of what they're doing,
Okay.
and appreciate their work. So Dysunderstood is actually the organization that I started. It's more of a community platform. But Solve ME/CFS is a nonprofit that provides resources to individuals with ME/CFS and education to physicians, in addition to conducting research and working to change policy around supporting individuals with ME/CFS and raising awareness of these debilitating and often disabling conditions. And they do a great job of advocating for patients, and they're working to try to increase awareness also around long COVID and help people understand that, these post-viral illnesses have been around for a really long time. And, there's increasing acceptance in the medical community about these issues. And they're trying to leverage that to do really great work to support, the people with illnesses that have been dealing with these for decades, to say, like, hey, like, now that you recognize this is a problem with COVID, we have to recognize that this has been a problem for a really long time. And there are a lot of illnesses that we have a lot of work to do in to to support these patients and increase their quality of life and improve the care that they're receiving. So they do really great work there.
What are they attached to Stanford?
So I believe that there are a couple physicians that are associated with Solve ME/CFS, but it is not a Stanford affiliated.
Okay.
Yeah.
All right. Thank you. What advice do you have for somebody that was recently diagnosed with ME/CFS?
Oh, I mean, I do have a lot of different advice, and I think um one of the most beneficial things that I was able to slowly develop was patience for myself and my body. Um, Oftentimes, we develop these illnesses as a result of a challenge that our body is facing. And it was really, really hard for me to put down my arms and stop fighting my body and trying to force exercise and different activities on it. But I think that like listening to what your body needs is a very hard skill, but a necessary one to achieve any sort of healing. And so, um, you know, trying to figure out what allows you to slow down and take the time to rest is a process, but a really important one. And I hope that, people are able to recognize that this is not their fault. They did not do anything wrong. They don't deserve this. There are other people that are fighting this that want to work to hopefully eventually find a cure and a treatment that is effective and sustainable and healthy, and all of these things. But to first try to be able to talk to yourself in a way that allows you to heal and is not not hurting you even more because you're already managing so much. And also to really invest in the relationships with the people that are going to be there to support you no matter what state you're in. I think those are the two things that were the most helpful for me.
All right.
That's excellent.
Yeah, excellent is right. Before we wrap up this episode, Ella, could you please tell us and our listeners how they can learn more about you and your advocacy? Where can they find Dysunderstood? Is that a Facebook group, or is that a website, or?
So yes, it is a website, and you can find it at www.dysunderstood.com. So I actually chose the name because one day on my Instagram, I asked my followers, what word describes your experience with dysautonomia, chronic illness, and disability, and the number one response was misunderstood. And so I created Dysunderstood as an opportunity for patients to share their stories, or caretakers or providers to share their experiences, one, to raise awareness, but also create a community for individuals that are either managing or affected by these illnesses. And so the blog portion of Dysunderstood is the patient stories. And it is also an Instagram account, which is just at Dysunderstood. You can also find some of the links and information on my Instagram, which is at Ella Eastin, Eastin. And I, appreciate any following and support. We have more things coming up as I continue to grow the organization. I'll be hosting an event this summer. We have a lot of growing to do, and I'm hoping to use this momentum around long COVID and other things to maximize awareness of these conditions, and also provide a place for individuals that are suffering with these illnesses to find other people to help them on their journey. And so it's been a really rewarding experience, very therapeutic for me, and also has helped ground me in the reason for me continuing my medical education, and reminding me, the reason that I'm here in the first place, and continue to connect with others that have experiences like me or different experiences, and just be there to provide a supportive community. So it's
Great.
been wonderful.
Yeah, absolutely.
We had a former guest that we've spoken with a couple of times. Her name is Kathy Reagan Young, and she operates a support network herself called Patients Getting Paid. And what it is a network of virtual work that's available to people with chronic illnesses. Can I send you her information, and maybe you can cross paths, and you could promote hers,
that
and
would
she
be
could
great.
promote yours? And all right, I will send you an email.
Absolutely. I think that is something that I'm really passionate about, is providing opportunities for individuals with these illnesses to obtain work opportunities, even when they are, limited by energy or mobility. I think it's really important that we provide opportunities for people to feel a sense of purpose in helping others. And so I think that's a wonderful initiative.
Great. I will send you that email so you can connect.
Fantastic. Ella, thank you for sharing all of your information with us and for joining our show today. It was very enlightening, and we look forward to following up with you in the future.
Yeah, we'd like to talk to you once you're a big-time white coat lady.
Well, thank you so much for having me. It was wonderful to speak with you, and thanks for all the awesome questions and spending your time to do this. I appreciate the your guys' platform and your mission, and I think it's really wonderful to share all of this with the world. So
Thank you.
Thank you.
Thank you.
And if our listeners have any questions or comments related to today's show, they can contact us at PodcastDX@yahoo.com, through our website, PodcastDX.com, on Facebook, Pinterest, TikTok, YouTube, and Instagram.
And I guess Spotify, too.
I forgot that one. Spotify, too.
If you have a moment to spare, please give us a review wherever you get your podcast. Please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regime. Never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.
Thank you.